Good afternoon, Miss Smith. My name is Julia Sorber and I will be your nurse today. How are you doing? Okay, good. So first, I would like to explain what Dr. Stone, your dermatologist, diagnosed you with: basal cell carcinoma. Basal cell carcinoma is a superficial cancer, meaning it is a form of skin cancer, but it does not invade your body any deeper than the basal layer of the skin, which is like the bottom layer of the skin. It is malignant cells in the basal layer of your skin, which means it is multiplying and can harm you if it's not removed. However, it grows slowly and typically does not metastasize, which means it does not spread. I know cancer sounds very scary, but this is really a very mild form of cancer, and it can be removed fairly easily. A sign of basal cell carcinoma is red or pink bumps, a little open wound looking bump, or a pale or waxy bump that is on a part of the skin that is frequently exposed to the sun. So you typically get them on your face or neck, like you have on your face. The procedure Dr. Stone will perform is called Mohs surgery. This surgery has stood the test of time and proven it is the best way to remove skin cancer. In the operation, Dr. Stone will lacerate the skin and cut away parts that are cancerous, layer by layer. A curette, which is like a tiny spoon, will be used to remove the cancerous tissue from the normal cutaneous tissue. After each layer is removed, a histologist will look at the skin under a microscope to see the cancerous roots. From this, they are able to map out precisely where the cancer stops and make sure they get all of it. They ensure this by dyeing the edges and make a trail where they have already been. The cut will be inferior to your eye. It will run transversely across your cheek and stop superior to your jaw. The width and depth of this laceration is dependent on what they find once they're in the operation, so how much cancer is actually there and how far it spreads across your cheek. The length of the surgery will depend on how much skin they have to remove during the surgery. Typically, the procedure lasts a few hours, but it could be more than that. One of the best things about this procedure is that they microscopically examine the area multiple times during the surgery to make sure that they remove all of the cancerous tissue. When you come out of that operating room, you will be completely basal cell carcinoma free. A few things you should know before going in: this will be a laceration across your face, so you should really avoid using foundation or blush or any type of makeup in that area for the next couple of weeks, because it could get in the cut and cause an infection. Although we have a wonderful surgical team that is very experienced in doing stitches, this surgery does frequently leave a scar. Just know that a small scar is much better than letting the cancer grow. For the best outcome, you should not remove the bandage for 24 hours after surgery, and then following those 24 hours, clean the area daily with mild soap and water to avoid infection. You also should keep the area moist. Dry wounds tend to take longer to heal, and they leave a worse scar. Avoid any activity so that you don't reopen the wound. And then call our office if it becomes infected. So you would know if it becomes infected by if it turns very red, if it's hot, if it's painful, and if it swells up. Dr. Stone will prescribe you medication, so you will be in the least amount of pain after surgery. If you do experience pain following that medication, so if you run out of that medication and you're still in a little bit of pain, you can take some Tylenol. Just make sure it's 5 days post-surgery. So wait 5 days at least until you take Tylenol, and make sure not to mix it with the medicine that he's prescribed. Do you have any questions that I can answer for you? Okay, great. Well, we will need to schedule a follow-up in about 2 weeks to have those stitches removed. Do you have a date in that area that would work best? Okay, March 13th at 4:30 p.m.? Yes, that sounds perfect. Thank you so much.